welcome to this discussion. Today we're going to be looking at disorder of prostate. But before looking at the disorder of prostate cancer or prostate, we have to firstly understand what is prostate and what is the importance of prostate in the male reproductive system. So prostate is a gland in the male reproductive system that produce fluid for semen and help maintain fertility. So prostate is part of the male reproductive system. It's part of the male reproductive organs that help produce fluid for semen in the pelvic and below the bladder in front of the urethra. There's a pictorial diagram of prostate. So you can see here, up here as you can see, there's a urinary bladder. Right here there's a urinary bladder, and down here you can see there's a prostate, both sides. So the prostate is on both sides of the urinary bladder. So there's a normal prostate. So this is the size of a normal prostate. So here you see there's a urethra. So whenever the urinary bladder is filled and then you have the sensation of urination, the prostate is going to dilate, meaning the prostate is going to open, and then the urine is going to pass through the urethra and it's going to urinate. Upon urination, this same prostate is going to come back together, it's going to contract, and then the urethra is going to be closed before you have dribblers of urine. Right? So this is a normal prostate. Now, here you see this abnormal prostate, or they call it a large prostate. So when the prostate has become enlarged here, means that it's going to be contract, it's going to contract, and you're going to close the passage of the urethra. That's going to make the issue of urination very difficult. Prostate disorder conditions, you're going to understand that urination is going to be very tense. It's going to be very difficult for you to get urination, because once the prostate down here get inflamed, meaning enlarged, then definitely urination becomes very, very difficult. But not only urination is going to get difficult, it also comes with other complications. Disorder of prostate. What leads to disorder of prostate? What are some factors that leads to disorder of prostate, or sometimes turns to prostate cancer? So before going to what leads to disorder of prostate, let's look at the functions of prostate. What is the major function of prostate? Why is prostate part of the male reproductive system? Right? To control urine flow. That is one of the major functions of prostate. To control the flow of the urine. The prostate surrounds the urethra and helps regulate the flow by contracting and relaxing the muscle. So the prostate is going to contract when there is no urination, or when there is no symptom of urinating. The prostate is going to contract, closing the urethra so that they cannot beat a dribble of urine. But when there are sensations of urination, the prostate is going to relax, or it's going to dilate. In other words, dilate the urinary muscle, and then you're going to have a urine flow. Type of prostate disorder. So what are the various types of prostate disorder? It's called the benign prostate hyperplasia, and another one is called prostatitis, and we have prostate cancer. So these are the three major causes of prostate disorder. In this video, we're going to look at the benign prostate hyperplasia, which is one of the disorder of prostate cancer, or prostate, which is one of the major disorders of prostate. It is a non-cancerous enlargement. It is a non-cancerous enlargement prostate gland. It occurs in elderly men and can cause urine problem due to prostate pressing against the urethra. So here there is an enlargement of normal cell within the prostate glands. And once the prostate get enlarged here, means that it's going to press against the urethra, and then it's going to cause, urine constraint. It's going to cause issues of the patient urinating. But let me give you some complications with the benign prostate hyperplasia. Now, when there is a constraint within the urine, and the prostate is a large that is pressing on the urethra, and urine is unable to flow. There are few complications. One has to do with urinary bladder distension. It will inflame the urinary bladder because there will be a lot of urine continuously packing within the urine, so it will be unable to flow down properly. That's one. Two, it will sometimes lead to growth of bacteria within the urinary bladder, because once the urine continuously getting tense within the urinary bladder and it's not coming up, there is a possibility of bacterial growth within the urinary bladder. Another complication to do with, once the urine get overflow in the bladder, there is a possibility to have a urine backflow within the kidney that can cause acute kidney failure. Causes and risk factors of the benign prostate hyperplasia. Aging is one of the major factors of this prostate. Another one is hormone regulations. So we also talk about family history. So the benign prostate hyperplasia is also has to do with genetic factor. So for an example, if your father over the age of 50 get this prostate, there is a possibility that you as a son can also get this cancer, or that you can also have this the identical condition. Then also comes with obesity, lack of exercise. Look at signs and symptoms of benign prostate hyperplasia. Frequent urination is one of the major signs and symptoms of this, especially at night. So people with BPH will always have frequent urination, especially at night. Weak urine stream or difficult starting urination. So people that have this BPH will always find it difficult to start urination. They sometimes have painful urination, and when they want to start the urination, the urine can be dribbling. So the urine stream will be very weak, right? Urgencies to urine, but inability to empty the bladder completely. So always the patient will feel like, I want to urinate. They will get a sensation, they will get a feeling that they want to urinate. But if they go to urinate, the urine is not coming, right? The person will feel that I still have a urine in my bladder, but the urine is not also coming. So these are some signs and symptoms of BPH, dribbling at the end of the urination. So at the end, you see that the urine is not coming fully, so there will be a driblet means the urine is going to be dropping one at a time, right? So you also have urine retention. So the urine will get emergency. There's a frequency that you want to urinate more, but the urine is going to get retained. The urine will not come. The urine will not be coming. So you also have urine frequency and urgency. So in more instances, you want to urinate faster. You always have the sensation that, okay, I want to urinate. But if you go to urinate, the urine is not coming. And frequency, every 5 minutes you want to urinate. Every 5 minutes you want to urinate. But once you go to urinate, the urine is not coming. So these are some signs and symptoms of BPH. Then go to diagnosis of BPH. So there are different diagnoses of BPH that are actually being used. You can do the urine test or the ultrasound, right? You can do the PSA. So in most cases, they do the PSA test for these people, right? The PSA test is going to help to know as to whether the person has BPH, to know as to whether the person has prostate cancer, to know as to whether the person has prostatitis. We found a video where we're going to talk about what is the difference between BPH. We'll talk about prostatitis, and we'll also talk about cancer, prostate cancer. So let's look at case study in BPH, in the benign prostate hyperplasia. So we see the patient, Mr. John Doe, coming to the facility, and at the age of 67 years, with past medical history of hypertension, and was being controlled by medication. In most instances, they gave amlodipine for maintenance of hypertension. So look at the chief complaint. What was the chief complaint that this patient came with? Increased frequency of urination. That's one. He had increased frequency of urination, especially at night, 5 to 6 times per night. Difficulty in starting urine. The patient said whenever he get sensations of urination, when you go to urine, the urination will get difficult to come. It's going to get so difficult to start. Feeding or incompletely bladdering or emptying of the bladder. So other diagnostic tests for this patient. So under the diagnosis, we order for the PSA test, and the level of the PSA test was 3.5, showed that the PSA was normal and ruled out prostate cancer. So it definitely ruled out prostate cancer because of the range of the PSA test. So it ruled out prostate. So we order for ultrasound, especially prostate size. So the prostate size were more, maybe between 20 to 30. But then we order for prostate size, we see that the prostate size was 60. So it means that here, these patients were diagnosed with benign prostate hyperplasia. Thank you so much for watching and always following us. So we want to say, you can please follow on YouTube. We are also on YouTube as well, called Dr. Dennis. It's also on YouTube. So we say thank you, and thank you for following us.